prostate cancer screening begins at the age of 50, and at the age of 55 for all other people. So that would include the rectal exam along with a blood test. Can you go back one, please? So today, to the second slide. So today we're talking about cancers that affect the colon and the rectum. So that includes men and women, everyone. So basically, the colon is part of the large intestine. After you eat your food, it goes through the stomach, through the small intestine, and into the large intestine where water and nutrients and electrolytes get reabsorbed. And then it goes into the rectum where you store your stool before you let out your waste. So we're talking about cancers that affect that area of the colon. So the American Cancer Society predicts that this year alone, there will be 150 new cases of colon cancer. More than 50,000 Americans will die from colon cancer. Out of the 150, 20,000 of them will be black men and women. And more than a third of them will die from the disease. Can I have the next slide, please? And this is because of a lack of screening, a lack of awareness about the illness, and poor access to health care. So if you can take a look at the graph there, just know the red line represents our community, black men and women. And you can see that we have the highest incidence of colon cancer compared to all other ethnic groups. Luckily, the incidence has been decreasing over time, and that's because some people actually do get screening, so we know that screening works for sure. But the problem is we're still at the top of the list, so more of us need to get screened. And colon cancer is the second leading cause of cancer death in the United States. Next slide, please. So, unfortunately, black men specifically die more than everyone compared with race and sex. So out of the black men and women, black men die the most. And that's because black men don't like to get screened, don't like to go to the doctor. And so a lot of my community service efforts have been geared towards black men. But I also start with the women because the women are often the ones who convince the men to get the test done, right? Right. Okay. So the next slide. So I don't expect you to be able to read this, but I just want to make the point that because of all these risks that we see in our community, it's been recommended for over the last 10 years that black men and women get screened for colon cancer earlier than their counterparts. So the screening age for black men and women has been for a very long time that it's 45. But not many people know about that. For the average population, it's 50, but for us, it's been 45 for a long time. So next slide, please. So the American Cancer Society recently published some data that showed that there is a new problem, and the new problem is that there's more people who are less than the age of 55 who are dying of colon cancer. In that group, what that group has in common is obesity. And of course, our community is disproportionately affected compared to other groups. So even the American Cancer Society has made a new recommendation, and that is for all people to get screened at 45, black, white, Hispanic, and Asian. So next slide. So some of the signs and symptoms of colon cancer. The tricky part is some people can have advanced cancers and not have any symptoms at all. If you're lucky to have symptoms, then typically it's seeing blood in your stool or blood when you wipe. It is not appropriate to assume that when you see blood when you wipe that it's from hemorrhoids because you never know. So you should get examined and you should confirm that it's hemorrhoids, but you should not skip a colonoscopy with the assumption that the blood that you see is from hemorrhoids. Some other symptoms would include low blood count, anemia, fatigue, weight loss, worsening constipation, and abdominal pain. Next slide, please. Some of the risk factors that we have as individuals that we can't do anything about is age. If you're over 60, you're at higher risk for colon cancer. If you're a man, you're at higher risk than a female. And genetics sometimes play a role. So what's interesting is that I have a lot of people in my office that say, my mother doesn't have colon cancer, my father doesn't have it, my sister, my brothers. I don't have a family history, so I don't need to get screened. But that's actually not true, because the large majority of colon cancers in the United States, over 90% of them are sporadic, which means that they occur in individuals who do not have a family history of colon cancer. I can personally tell you a story of a woman that I trained with. She's also a gastroenterologist. She's 42, and 2 years ago, I diagnosed her with colon cancer, stage 3. She had no family history. She was married. She had a son that was 2 years old. Luckily, she got treatment and she's well, but I think we need to pay a lot of attention to when we have symptoms, not to disregard them, and go to the doctor in a timely fashion. And please, if you don't have a family history, it does not mean that you're completely protected from the disease. So next slide. So some risk factors that we can change. Obesity is a problem in our community that we deal with. Diets that are high in red meat and processed meat. And processed meats include like bacon, sandwich meats, sausage, cured meats. Tobacco in any form is no good. Excessive alcohol use and a lack of exercise is also a huge risk factor. Next slide. So let's talk about obesity. So the BMI is a score that we use to calculate our risk factors for certain disease. It takes into account your weight and your height. And if you have a BMI over 25, you can be considered overweight or in the obese category. However, sometimes the BMI doesn't consider different body types. So if you're more muscular, or if you have bigger legs or bigger bottom or bigger breast, you might be perceived to be overweight by the scale. I'm actually overweight on the scale too. So what you need to consider, it's true, I'm considered overweight by the scale, but what you need to consider is your waist circumference. So the waist circumference for women should be less than 35 or less, and for men it should be 40 or less. So that fat around your waist is the most dangerous kind of fat you can have, because if it's around your waist, it's in your heart, it's in your liver, it infiltrates your pancreas and all your organs. It puts you at high risk for diabetes, heart disease, stroke, hypertension, high cholesterol. So these are, and all of this I'm sure sounds familiar, because these are the issues that plague our community more so compared to other communities. And we really need to take a look at what we're eating, right? So next slide. So fiber, we need more fiber in our diet. We need more raw fruits and vegetables, okay? Usually when I talk to people about taking fruits and vegetables and diet, everyone says, oh yeah, I eat enough. But how much is enough? Does anyone know how much is enough? How many grams of fiber do you need in your diet on a daily basis? So it's 25 grams. Can you go to the next slide, please? So if you were to actually take 25 grams of fiber in your diet, you would eat 12 and a half ounces. This is all in one day. 12 and a half ounces of dark chocolate, 5 and a half oranges, 3 and a half cups of shredded coconut, 7 cups of blueberries, 2 cups of peanuts, 15 little raisin snack boxes, and 8 bananas. That's all in one day. So only people usually are able to keep up with that kind of fiber intake are vegans and vegetarians. So sometimes I like to recommend that people take Metamucil. It's an over-the-counter, non-soluble fiber. You mix it with water and you drink it 3 times a day, okay? Let's see. And also, the other problem with our fruits and vegetables, when you're eating raw fruits, that does not include if you're putting sugar over it or caramel or mixing it with ice cream. That kind of like cancels out the benefits of the fruit. If you're having vegetables, eating collard greens with, you know, salty pig feet in it, or like what do you call it, turkey leg, just eat it raw. Fruits and vegetables, raw fruits and vegetables. That's what we need. Okay, next slide. So tobacco, obviously a big no. Tobacco in any form, cigarettes, cigars, pipes, whatever, it's all bad. People often ask me, is that the same as smoking marijuana? If you're rolling your marijuana in a frontal leaf is tobacco. So if that is your habit to smoke marijuana, and I'm not condoning it, but if you do, please try to use a bamboo or non-tobacco wrappings. In terms of alcohol, anything more than 1 or 2 drinks per day is considered excessive by the American College of Gastroenterology, so it's considered a risk factor. So, and the number of drinks, it doesn't matter what type, beer, wine, vodka, is all considered the same. It all has the same effect on your body and your immune system. So medically, we don't differentiate. So one bottle of beer is the same as a glass of wine, is the same as a shot of vodka, medically speaking. The only difference is the number of calories and alcohol that you consume. So beer and wine tends to have a lot more calories and a lot more sugar. So if you must have alcohol, those are the things that you need to think about. Next slide. So exercise, we all need to get exercise. You can start at your level enough that you break a sweat, and that's considered helpful. Anything that increases your heart rate. Of course, if you have a history of any heart problems, lung problems, you should see your doctor first and clear that. Thank you. Before you do that. But exercise is very important, and lack of exercise is considered a big risk factor for colon cancer. Next slide, please. So these are the wonderful women that I work with every day, the endoscopy nurses that are really great to our patients. So I just wanted to speak to you about what you should expect when you go anywhere. You don't have to come to Brookdale, but when you go anywhere for your screening colonoscopy. So usually the day before, you do some type of fasting, and then you drink some medication that purges your system, basically causes you to have diarrhea and clean out your whole bowel, so that when you do get the procedure, when we go inside, we can take a look, we can see everything, exactly what we're doing. Next slide, please. So what happens is you get put to sleep. In most centers, you get completely put to sleep so that you don't experience any pain or any discomfort. And when you're asleep, I'd place a long flexible tube. It's about the size of my index finger, but it's about 5 feet long about. It goes into the rectum, and it moves all the way around your whole colon to the beginning of your colon. If I see anything that, any polyps is basically what we're looking for, precancerous lesions, I'm able to take it out all in the same procedure. The risk factors with the procedure include bleeding. Obviously, you can imagine if I take out a large polyp, there'll be more bleeding than smaller polyps. There's a risk of infection, but we clean our instruments appropriately, and there's a very small risk of what's called perforation, which means I could mistakenly tear a hole in the colon. That is highly unlikely. I've never had it happen to any of my patients, and I pray that it doesn't. Most complications of the procedure are usually handled non-surgically, and it's not really an issue. After that, you're sent to the recovery room to recover for about an hour, and we watch you while you're there. So I just wanted to show you guys some pictures of what we're looking at when we go on the inside. Yes. So this is a normal colon. You can see it's smooth. It's nice and pink. There's no growths or anything like that that you can see. Next slide, please. And this is what we're looking for. This is a polyp. This is a very small polyp. Believe it or not, these polyps are classified as adenomatous polyps, which meaning that if you leave them there and they grow and become bigger and bigger, they can eventually become cancerous. So the whole point of the colonoscopy is to go in and get these precancerous lesions, take it out, and then overall decrease your risk of colon cancer. Next. So this is also a polyp. This is an even bigger polyp. But you can see the little piece of skin connecting the colon to the polyp. So it's something I can still take out, but with a little bit more time and more effort. So the bigger the polyps are, the more risk that they have cancerous components in them, and the more risk you have overall of developing colon cancer. So if you came in and you had the small polyp that I showed before, I would probably repeat your colonoscopy in 5 years. If you had something like this, I would be more aggressive and repeat it in 3 years after we take it out. So the next is what we don't want, okay? This is frank cancer, okay? So those polyps can start from that small thing, grow to the bigger thing, and now to this, where it's invaded the muscle layer of the colon and now has access to your blood vessels, your lymph nodes. Next slide, please. Okay. So this is just kind of a cartoon that illustrates what I've been talking about. So you see the small little bump was the initial growth. If you leave it over a course of time, it grows bigger and bigger and develops cancerous components. Those cancerous components can then spread and invade into the muscle layer. And beneath the muscle layer is where you find a lot of blood vessels and lymph nodes. And once the cancer gets access to that, that's how it spreads throughout the whole body. Next slide, please. So this is, just a schematic of the cancer spread. So usually left-sided colon cancers will spread to the liver. Those on the right side of the colon will go to the lungs, and it can even spread to your bones. So once you get to the point and you're actually, having symptoms and you have a diagnosis like this, your 5-year survival is pretty low. So next slide, please. So the take-home facts. Colon cancer is the second leading cause of cancer deaths in America. It can start without any symptoms, and blacks should get screened at the age of 45. The procedure itself is painless and low risk, and colon cancer is very treatable and preventable. So I have 3 different clinics, and this is my contact. If you are interested in getting your screening done at another facility, I can again give you a referral for that as well. Does anyone have any questions about what I've presented? Okay, right. Yes, so it's the same for men and women. The difference is between black men and women and other people. Honestly, I do a lot of my screenings for my patients because my patients are predominantly black. I do them before 45. I have never had an insurance issue except for one time, and that patient, actually, his problem was he was just poorly insured. So he didn't have enough coverage and he had a high deductible. So it wasn't that his insurance didn't cover it, it's just that his insurance coverage was inadequate. So I have never had a problem convincing an insurance company to do one for a black individual who was 45 or within that range. Uh-huh. Mhm. Right. So the difference is how often you do your colonoscopy depends on what we find when we're inside. If you have 1 to 2 small polyps or nothing at all, a completely normal colon, if you have a completely normal colon, you can repeat in actually 10 years, okay? If you have 1 to 2 small polyps, you can repeat in 5 years. If you have 3 or more, you repeat in 3 years. If you have a very, very large polyp and there's only 1 of them, you can repeat in 3 years. If you have a family history, a mother, father, sister, or brother who had colon cancer younger than the age of 60, no matter what they find, they should repeat your colonoscopy every 5 years. So, and some people have genetic syndromes where they make lots and lots of polyps, and those people repeat their colonoscopies every year. So the interval depends on what we find on the exam. You're welcome. Yes.
It was stage 4. It was stage 4. I do everything normal, and I did not have cancer. When I went to Jamaica, that's where they found my cancer. I want to know if when I did my surgery, if it's wise for me to repeat.
Oh, absolutely. If you have colon cancer or you've been diagnosed before in the past,
Yes.
you should have a repeat colonoscopy. Usually the way it works is 1 year after the surgery, you have a repeat. The next colonoscopy is scheduled for 3 years and then for 5 years.
Okay. Why I'm asking,
Uh-huh.
when I went to my doctor 3 weeks ago, he says I'm cancer free, so I'm not in a risk factor.
Right. Did you have surgery for your cancer?
Yeah, colon.
Okay. How many years has it been since you had your surgery?
9.5 years.
Okay. Did you have a colonoscopy 5 years after your surgery?
No, I never have one since.
You should.
Okay. I'm going to ask him to
Is
do
it your primary care doctor that you ask?
My cancer doctor.
You should talk to your primary care doctor or your gastroenterologist.
Okay, I will call them tomorrow and make an appointment.
Okay, excellent.
Because the test says I'm cancer free, but you are telling me something now
Right.
that I should still repeat the colonoscopy.
So yeah, even if you have a diagnosis of colon cancer, you deserve follow-up. Even if you're cancer free, you still have to have follow-up.
Thank you.
You're welcome.
I just want.
Oh. Sure.
Trying to tell you how you're going to do your thing. Remember this. She only giving you her educational background of what you should be considered. Because remember this, I don't want nobody leave from here no man say, Doctor A send me if you go do so. Are we clear? Yeah. She's giving you medical expertise, knowledge. Amen.
Thank you.
I'm just asking, in the case of a married couple, if the husband is diagnosed with colon cancer, is it possible for it to be transferred to the wife?
No.
No?
No. I have a feeling I know what you're referring to, and we can talk about it after, but no.
Okay.
Sir. You said any type of pills?
Yeah, something similar like the herbs, like the cerci leaf or the aloe leaf, that we can use on a month-to-month daily basis to remove the waste. Like, you know when you empty a garbage can, there's still waste underneath? There's still a little bit of waste underneath the garbage can when you take that bag out. That's kind of like our immune system when we need to take a washout. Is there any pills that you would recommend that's really good for washout? Like, because some of the foods we eat, no matter what we eat, sometimes we eat vegetables, fruits, and when we need to detox, that's the most important thing as well as the fasting, resetting our immune system. Our metabolism doesn't eat away certain food fast enough, so that's why we have to work out, because whatever the acid doesn't eat away, when we burn energy with kinetic movement, automatically that helps us, but even that alone is not enough. Is there any type of pills that you would say over the counter that's safe and can also help provide the necessary nutrients and protein that we don't get in our meats and vegetables?
So in terms of detox, that's not really something that I subscribe to. There's lots of things that are sold over the counter, whether it be herbal or pills in the supermarket. The problem with those things is that they're not FDA regulated, and the active ingredient is unclear, and how much of the active ingredient is in that particular product is also unclear. So you don't know what you're taking, you don't know how that's going to affect your body or even interact with other medications that you're taking. The whole idea of fiber, that's the job that fiber does, right? So, you know, some people call, like my mom calls salad roughage. So roughage is responsible for cleaning out your system. So the more fiber you eat, So that's just plain raw fruits and vegetables. The more you're going to eliminate in a daily basis, because fiber is very bulky. What it ends up doing is stretching the lumen of the colon and causing you to have more frequent bowel movements. So that is the only kind of like cleanse that I would recommend.
Right. Thank you.
You're welcome.
Okay, I'm a cancer patient. I was diagnosed.
Be strong, be strong.
I was diagnosed September 2nd with colon to the liver and to the lungs. And I was told it was stage 4.
Mm-hmm.
And I notice some of the time when I take the chemo, like the day after, I have a tightness in my stomach, as if it want to stop my breath. I want to know if that is really an effect from the chemo, if it's a side effect.
So I'm really sorry to hear about your diagnosis, first of all. Yeah, I'm not an oncologist, so I don't prescribe chemotherapy agents. So you would have to speak to your oncologist about that. I'm gastroenterologist, so I just diagnose these disorders, and then after I diagnose, they go on to the oncologist who prescribes the chemotherapy and radiation and such. So I think that question would be better for an oncologist to answer.
Okay.
Okay.
All right.
All right. I'm sorry.
Just to follow up with the type of food you eat.
Mm-hmm.
Organic stuff compared to normal food. What's the difference? What's best?
So I don't know. That's you're talking about like non-GMO things that are not genetically modified.
Yes.
Yeah. So sometimes when they modify fruits and vegetables, they do it so that it lasts longer, so they can bring it from the farm and travel. And so it's all about money making, right? So it's not in the best interest of the people who are eating it. So sometimes genetically modified foods are less nutritious, have less, vitamins and minerals. The only advantage they have is that they can sit on a shelf longer so that you can buy it and for the companies to make money. So that's the difference between the regular like organic foods and genetically modified foods.
So if I take what you're saying, it's all about money making. It's not like more healthy for my system.
No, I'm saying the natural foods are more healthy.
Okay.
The genetically modified foods, they just do that for the sake of preserving the shelf life of the food.
Okay. Are you saying that the organic stuff, if it's natural making, is more healthy for my
Right,
body?
right. That's
Okay,
exactly
all
what
I
I'm
need
saying.
to know.
Yes.
Thanks.
Can I help her right here now?
Sure.
The one the grandma plant on her back.
Yes, exactly.
They don't put pesticide and insecticide and all of this. That causes side effects. So if you come a Bible study, we teach about side effects. so when you go pick the mango, those who from Clarendon, and you do some pick up the mango off a tree, you need to wash it. So when we were picking and I grew up down, so we did a wash mango. No, I'm going to go. When you smell the sour sap, mama price. When you the way down the road and smell all the sour sap, and you go up there and do so. Listen to me, man. That's what we need back now. Amen.
Yes.
One more question. Colon to the liver. Does it shrink the liver, or when it is shrink, does it come back?
When the tumor shrinks?
Yeah.
It can, and that's why usually cancer patients undergo surveillance, like you have to repeat imaging and so forth, right? During the time of your chemotherapy.
Okay. So how long would one survive with the stage 4?
I can't answer that question. Again, I'm not an oncologist. That's not a question for me. Yeah.
Amen.
Uh-huh.
My time. I'm curious about the why the African American we would say it, or the black is more prone to this cancer thing.
Wait, say it again.
Why is it that the African American, I would say black, is more in the cancer colonies high risk? Why are we
Okay, so they have actually done studies about this. So they compare African Americans and their rates of colon cancers to people who are from West Africa, which we think that genetically these are the same group of people, they just live in separate spaces, right? So Ghanaians, Nigerians, and so forth have lower incidence of colon cancer because they have different diets, right, than African Americans who live here, right? So if you are living in Ghana or Nigeria right now, your diet is mostly fruits and vegetables. Meat is something very scarce that most people can't afford, and they eat it maybe once a week. Americans, we eat meat with every meal, so that's the difference, you know. And if you're an immigrant and you come from one of these places and you're here, you're physiologically you're American after 6 years of being here and eating the diet that's here. So you assume the risks as an American as well.
So you're saying to us then that the food we eat have a lot to do with...
Absolutely. Absolutely. Like I explained that the new statistics show that there's a group of people who are less than 55 who are dying of colon cancer. We've never seen that before in America. In that group, the only thing that group has in common is obesity. So it's the diet, you know, it's the diet.
Any more questions?
I know you're not a pediatrician, but say, for example, you have teenagers and you have a young lady in their 20s, whether she's at risk or not, whether with a family history or not, what would you advise them in terms of exercise? Like, how much exercise should we be getting every week or daily?
So average exercise is 3 to 4 times a week, about 30 to 45 minutes. It has to be vigorous enough that you break a sweat and you increase your heart rate. That's what I would suggest. Are you talking about someone who's overweight as well, or? Okay, so I think, you know, if you're living here in America, you're kind of deluded into thinking that exercise is the key to weight loss. And the reason why we all think that is because Nike does a really great job of convincing us that so they can sell sneakers and workout gear. But the truth is 80% of weight loss is diet. It's all diet. Yeah. So start there, I think.
Any more questions?
Something that I come to my understanding or witness so far, it's that elderly people now, when they die, when they reach in their 70, 80 and they become sick, the diagnosis is always being cancer. You know, too much come to me and I see it. You know, is there any reason why that could be? Or
yeah, with most cancers, the risk of having that cancer increases with age. So if you think of it like for colon cancer, for instance, the risk increases if you're over 60. So the idea is that let's go back to the processed meats again. If you're exposing to yourself or you're exposing to your colon to that toxin every day for constantly every year, over a long period of time, there's an accumulative effect, right? So as you get older, your risk for the cancer increases. So it's the same for if you're, lung cancer and you're a smoker and you're smoking over a long period of time, the longer you smoke, the higher your risks are.
Do you need any more spiritual terminology? Not right now, my stomach full. Sister was over reflect about how much years you have left. The Bible makes it clear. The Bible is very clear that God already give you your time factor before you're born. Oh, you know what I'm talking to me now? Yes. Oh, you see, everybody gets scared out of it. What's the problem? I say God already give you your date and your time. Yes. And you can't die before your time. Yes. And cancer can't kill you before your time. Yes. Pressure can't kill you before your time. Guess what happened? Because somewhere along the line, God sent she here today to tell somebody your teeth can dig your own grave. Amen. Yeah. Amen. Amen. Because somebody take about 5 pounds of bacon and 4 eggs. Yes. True, sir. Love the bacon, love the meat. And then you come, Pastor, pray for me. You're going to Kings County. You're going to overweight. Yes. That's true. Oh. You know one, this, you know one, that. They try to give them something and complete. True, sir. And some people, they want to baptize all the food with the gravy. Yes. Well, everybody quarreled with me. How you have X amount of this? How you so? I said, exercise. Oh, no. What you eat? One nice lady come into one of the store a few weeks ago, and she ordered a large ox steak, and the miss put her due diligence in her plate. How did that get for me money? Then the attention leads straight back to me. Maybe the server I make work. You say, good morning. Yes, ma'am. I'm not saying nothing. You must eat moderate. Yes. Hello? Eat moderate. Did you hear what the doctor said? Let me see if somebody heard this. How many grams of fiber we should? 25 no? Yes. And that's it? Yes. For the day. You didn't even like the color, look. True, sir. I don't want none of those green tea. You know what time we do?